Good afternoon, everybody. I'm Joanne Kenen, and I'm the editor-at-large for healthcare at Politico. Today, we're having a live Q&A about COVID-19 vaccine mandates, Americans' sharp divide. I'm joined by Robert Blendon, Menschel, Professor of Public Health and Professor of Health Policy and Political Analysis, Emeritus at the Harvard T.H. Chan School of Public Health. I always tell Bob that if you printed that out, his title would be taller than me. You can post your questions for Bob and me on Facebook at Forum HSPH like Harvard School of Public Health. You could also email them to the forum, one word, at hsph.harvard.edu. The Q&A is jointly presented by the forum at the Harvard T.H. Chan School of Public Health and Politico. Well, as I think everybody watching us knows, in the US, new COVID cases are rising and they're rising fast. The Delta variant is now more than 80% of newly diagnosed cases. The 7-day average of new cases is more than 60,000. We're in the 60, 63, 65, depending on the day. That's a typical caseload of now of new cases. It's more than 4 times of what the rate was just in mid-June, just about a month and a half ago. The vaccine is widely available, has been for months, but fewer than 1/2 of Americans are fully vaccinated. President Biden fell a little bit short of his goal of 70% of eligible adult Americans by July 4th. That was for one shot, and we're still not quite there. As the cases increase, and as this is a very infectious, the Delta variant seems to be spreading faster than the other variants, we're hearing more calls for vaccines to be mandatory. And we're beginning to see the first mandates. Just this week, the first federal agency, the Department of Veterans Affairs, said it is going to require frontline health workers, not everybody in the entire VA, but frontline health workers are going to be required to get vaccinated. President Biden has said he is considering a COVID vaccine mandate for federal employees. 60 major health and hospital groups, including the American Medical Association, have called for all healthcare and long-term care, nursing home, other long-term care facilities, that they should be required to have the COVID vaccine. New York City is requiring city employees to either get vaccinated or get tested every week. Just a minute or two ago, I saw a headline flash across my phone that Governor Cuomo is doing something quite similar for state employees. California, same thing. State employees and healthcare workers have to show vaccine or undergo testing. On all 3 of those examples, the alternative is get the vaccine or weekly testing, regular testing. Even the NFL has made its views known. They have said, and this is about all I know about the coming season, that if there's a COVID-19 outbreak among unvaccinated players that lead to a game cancellation, that could also lead to a forfeit. It's not going to be all this crazy rescheduling stuff. If you have unvaccinated players, they get infected, you cancel your game, you're out of luck. Of course, many aspects of society have been impacted by policies around trying to contain the pandemic. We've been talking about carrots and sticks and incentives and messaging and how to convince people and overcome fears and big trust, but we're at a different moment now. So are these mandates coming? Will they work? Or will they backfire, given how deep the divisions really are over such mandates? A few weeks ago, Politico and the Harvard T.H. Chan School of Public Health actually polled on this issue, on mandates, on vaccine mandates particularly. There's been a lot of news since then, but before we go into that and take your questions, Bob is going to show us a few slides that sum up that's a snapshot of where we were a few weeks ago on the issue of vaccine mandates.
Joanne, thank you. I need to make just a couple quick points before you present poll results. So the first is, what does polling do here? It tells you something about the environment, the weather forecast that people in public life are going to face as they try to talk about mandates. And something that has occurred in the United States that insiders know, but they never discuss in the media. That is, public officials have come to a point where they pay a lot of attention to the results of their own party, but not the public in general. So in LA, you'd expect the city government to be very responsive to how Democrats see it. In the state of Texas, you're actually going to find the state government very responsive. to the views of Republicans. So when I present this, we're going to highlight not only everybody's views, but the two parties, because the governments matter. The second thing is, when you're talking about the importance of public views, they don't tend to matter a lot unless one side is 60% or more. And then it really sort of heats things up either way you're going to go. So we're going to look at different circumstances for requiring it. But I'm really going to pay more attention where you see 60% against it or for it, because it creates the environment that if I'm in public life dealing with this issue, I'm going to face. So let's take a look at the first slide, which involves some of the biggest controversies. And that's requiring the vaccine for young people attending school in person from 12 and up. And what could you see as a whole? The country is almost evenly divided, with Democrats favoring it and Republicans more than 6% not. But we also asked adults who were parents or had children living in the house, and you could see that they're almost split 50-50. And just what's important to recognize, because we've had a terrible battle in this country, that 50, close to 50% against by parents is much larger than the opposition to requiring childhood vaccines like measles. It's a much larger number of parents and adults with kids who are not prepared to go in that direction. And it has not been easy to get all parents to take the childhood vaccine. So that's there. The second is, which is being discussed, is we're going to require employees to be vaccinated before they come to work. And you could see it's slightly over half. It's not 60 on either side. But quickly you can see the majority of Democrats, which means if I'm in a Democratic city or state, I am much more going to see public officials receptive than if I'm in a Republican state, much less support. We interviewed people who were employed, and I need to discuss this because it's going to be the next wave of news articles you're going to read about. About half people who were employed favor being in a workplace where everybody's required. The other half didn't. But what's going on from other surveys you have to recognize is the Department of Labor has put out a report that says we have more people considering changing jobs than in decades. And then secondly, the employer surveys that are put out show that there are millions of openings, particularly in small and medium business, and employees won't come back. So you're going to have a situation that employees in many parts of the country have a wide choice of where they want to work. And that may play a role in how many businesses, particularly if they're small and medium, as distinct from the New York State government or something, that can do this. Next slide. So as Joanne said, and our poll was done before this, so the numbers are even likely to be stronger, 60 national healthcare institutions, professions, etc., endorsed mandatory vaccination in those institutions. And you notice, unlike some of the other slides I'll show you, there's a bipartisan consensus here for this. This is not an issue that the parties, or you're going to see governors as a whole arguing about. There is a consensus. And what's important to recognize, at some level, more than 1 in 10 employed people in the United States work in healthcare. So this is a very big move the ball along issue. Let's take a look at some of the other options where people could require vaccinations. Next slide. There's pretty much, not completely, but a bipartisan consensus and majority that public school teachers, so notice the divisions are much greater about students than they are about teachers and staff in schools. So there absolutely is, in general, support for that. There are similar levels, but it's not at the 60% level for universities, faculty, staff, very strong among Democrats, but you at least have half of Republicans willing willing to support this. So the lean towards public school teachers in broad support, lean towards universities, but not completely in Republican states, is likely what we're going to see in the next few weeks. Next slide. So the issue of travel is coming up, and the airlines are raising this every single day. So there's a bipartisan over 60% commitment that we should basically require mandated vaccines for international flights. The numbers are lower, but still over half, but not 60% for domestic flights. Cruise ships are just at 60, but not necessarily by Republicans. So it's no surprise that some Republican governors have been opposing mandates for vaccines for cruise ships. But as a whole, you're at the 60% level. And so particularly on international flights and ultimately on cruise ships, you're going to have the weight of public opinion shifting in that direction. Next slide. Joanne mentioned about the pro sport players. We don't know how people feel about mandating the players, but we do know that the majority, there's no 60%, do not favor attendees at sports events having to have a vaccine. So, and it's not overwhelming by one party or another. And then in terms of customers entering in stores, there's an overwhelming public view of both parties. I don't want to move in that direction. So this gives you an outline of where it is. And it suggests that particularly in public schools and employment, there is going to be conflicts and problems. At the other side, which is a massive issue, the support for healthcare institutions mandating 1 in 10 employees in every community in America is a very powerful next step measure, which looks like it has a level of political feasibility that we haven't seen before.
Thank you, Bob. Before we take questions, I know this is going to come up. I'm just going to, one of the questions that comes up all the time is, are mandates legal? Particularly since these are still under an emergency use authorization rather than a final, formal, normal, regular FDA permanent approval. I mean, they're going to be a lot of court cases. We'll be covering court cases from, there will be many challenges. But what we know so far is the EEOC and the Department of Justice have both said that they are illegal, mandates are illegal. There have to be some kind of accommodations, but these do, including under an EUA. We have seen 3 really significant court cases. Again, they're going to be, different circuits are going to rule in different ways, and it's going to be a legal mess for a while, most likely, but there have been 3 very significant cases that have upheld mandates. One is for cruise ship passengers, although I think that may have just been, there's something on appeal there, but there was about Florida, but there has been a decision on cruise ships cases, which I think that was just challenged. The healthcare system in Houston, they were upheld, that they can require healthcare workers to be vaccinated. And the first university court case that I'm aware of was the Indiana University's mandate, and that was also upheld. So right now, it is trending toward, yes, they can do this. It doesn't mean you're fired if you automatically, I mean, there's small print in these things. There's the testing alternative. You could have an argument over whether 1 test a week is enough, but there's going to be, there may be saying, you have to continue working remotely. You can't come into the office. I mean, we don't know exactly how it's all going to play out when we see the details of these mandates, but the initial read for where we are now is, yes, employers can require them. Yes, employers can ask you your status that is not HIPAA protected. And yes, at least some of the courts in this country are going to look favorably upon this. So I guess we can start taking questions now, but there may be other questions along those lines, but I thought that was worth sort of throwing out there.
Absolutely, because some are going to argue it's not legal. So that's the first stage.
Yes, and we're not going to have a total answer, and the courts may rule that some of them are legal and not others, depending on that small print, depending on what vaccine or what. So, for those of us who can work at home, that might be the issue. That might be the way things play out. Either you get vaccinated or you stay home.
Yeah.
But not everybody can work at home, as we are well aware. And healthcare workers, there is broad public support.
Yes, right.
Yeah. In nursing homes, it's really quite surprising how many workers still haven't been vaccinated. And this is it's a highly vaccinated population, but there are breakthrough infections, and this is a vulnerable population coming into contact with people who are unvaccinated, who have close physical proximity to them. Okay, questions? Bob, you want to talk a little bit about carrots and sticks? What do we know from our polling? Which kinds of carrots and which kinds of sticks is the public either embracing or rejecting?
So if we're talking about unvaccinated people, and that's really, if I'm vaccinated, I'm fine, whatever you want to do. But the unvaccinated, and it's important to understand here, this could be very difficult to change with them. These are people who repeatedly on surveys say to you, no way, I'm not going to do this, no way. So just something easy, let's have a lottery, has really been successful. But there has not been as good an understanding of the culture that people are saying no. For that, I want to take a minute or two to explain this. First, it turns out the people who are unvaccinated or from the cultures who are not for mandating vaccines or anything else have extraordinary levels of distrust of the Washington public health medical establishment. And so they really, and it has to do with the question which I pay a lot of attention to, do you trust the medical advice from, and you list all the people in Washington that are on TV every day. And the answer among the unvaccinated are no, I don't trust them. And so the second thing, which is very unusual, is we usually have vaccine debates when people are worried about, seriously about the illnesses. And the oddity is the cultures where people are not being vaccinated answer polls that they're not very worried. They're not worried at all about the Delta variant. So just think a second. We have this issue. We didn't start the vaccine for polio when parents weren't worried about the disease. They were absolutely terrified about their child being an iron lung and crippled or dying for that. And then the question is, how safe was the vaccine? And we're trying to sell to these people to take the vaccine when they're not worried the way the rest of the country is about this outbreak. So I want to make a point here about trust and where it is. There was an incident within 2 weeks that just caught my attention, caught the country's attention. And it's very important here. A critical care physician in Birmingham, Alabama, went on her own Facebook page, and she described caring for 2 patients who looked like they were about to die, who were begging for the vaccine, and they were saying to her, I made a mistake. I should have taken it. And so across the country, media picked this up, and what I observed was it was conservative media, liberal. They were saying, I don't want to die. And so one of the things that's really important about the information here is people who are not taking the vaccine have to be convinced they and a family member could die or have a serious illness. Herd immunity, there are a lot of terms we use in public health. For average people who have resistance, doesn't work. So my view is that the move for healthcare institutions locally to do this, if it was combined with them talking about, we have serious people here who are near death, who really are sorry they didn't take that vaccine, that can move the needle over time. But notice, I'm not talking about public health experts, and I'm not talking about primary care doctors who are not dealing with people in ICUs. But the people dealing with them, where they're actually talking to them and their families, I don't want to die, I shouldn't be here, I didn't realize that if I didn't take this vaccine, I could die. But a large number of the people not vaccinated are not worried about this disease. It's like saying, I don't worry about polio for my kids. So they have to worry. And so I'm less interested in carrots and sticks than I am convincing them they and their families could die or suffer unless they get this vaccine. And that is the critical message.
So, Bob, how do we get to that point? Because we have over 600,000 people dead in America. And they're not, and there are, yes, younger people are less risk, but they're not at zero risk. I mean, there have been deaths of people who are healthy, who are young, who are not it's not just in the nursing homes. It's not just people who have comorbidities. Yes, those are higher risk, but it's not zero risk for everybody else. The doctor, her name is Brittany Kobia. I just looked it up again. It's
yes.
really an articulate, impassioned
right.
Description of what she felt like. She talked about first she was sort of mad at them, like, you brought this on yourself. Right. And then she made this really wonderful point, a very compassionate point, which people are making these decisions based on misinformation, but misinformation from people that they trust. So if someone you trust tells you that the vaccine is more dangerous than the disease, or that the vaccine has a microchip in it, or that the vaccine is going to make you infertile, or that God doesn't want you to take it, if you're getting that from a messenger who is your trusted messenger, you're not going to listen to the CDC and NIH and everybody else.
But you will listen to a critical care physician from Methodist, Baptist, Baylor, and places where you send your family members where they're sick. They have nothing to do with Washington. They're not. And also, this is very hard to explain, but large numbers of people do not get emotional by statistics. So the rate is up 4%. And the thing, if you followed this, that just for advice to people, with the terrible tragic of the collapse of the building in North Miami, every picture of someone who died has been in the newspapers. The president came down to talk to the family about the governor came down. That's 98 people. But there's nothing. All we do is say Indianapolis has 40 more deaths. They don't feel. You don't know that. And the power of the critical care physician is you're talking about known people, the way a lot of people think about this. But statistics alone is not moving. It moves experts and people who follow that, but it doesn't do it. What stories about people who are dying that don't have to be. And when I was a child, I never got over the picture of these kids in iron lungs. You just didn't have to tell me. It wasn't the numbers. I don't want to be in an iron lung. And so they're giving all this false information about vaccines, but what you need are critical people to say, you and your family member could die, you can be in the hospital, there are long-term effects of some of this. This is very real for you. Then make some judgment about the vaccine, but they must be worried. I don't want my kid to get polio. I don't want to die in an ICU. And it has to be more individualistic. And we can't escape. There's just a bias by a share of Americans, which are not small. They just don't trust the federal government or federal scientists for that. And it's going to have to be somebody clinically, it's going to have to be locally, and it's going to have to come while local big medical centers are requiring their employees to get mandated.
So is that going to be, in your vision, is that people like this doctor who was so articulate on Facebook, or is it scientists? Is it your own physician? I mean, who is?
No, it's so my view is those 60 organizations have to get people locally who are dealing. So my doctor doesn't deal with critically ill patients. They send them off to the ICU or something. So it really has to be somebody who's dealing with this every day and gets on Oklahoma TV and et cetera, and says, look, I am caring for people who are at risk of dying here, who thought it just wasn't worth getting the vaccine. But it's an Oklahoma voice. It's an Oklahoma critical care physician. And it's on Facebook, but it also on local media. and there's no politics involved. Nobody in government telling you what to do of either party. It is somebody dealing with very sick people that are trusted locally. And those 60 organizations could make that happen without being an arm of the federal government.
There's a question here that we did touch on this in your slides, but let me sort of reframe it a little bit. In general, leaving not specifically about healthcare, but in general, from what you've seen in the polling, our polling and other research you've seen, is the public more accepting of mandates from businesses, employers, events, anything other than the government? Is the objection to mandates, or is it to government mandates?
So the most intense will be government mandates. People don't have the same sense of, well, the local CVS is requiring of their employees. I should have some say in what those companies do. So that they're much more tolerant. The problem with employers is what I said before, the reports of the number of people who don't have people working and are trying to get hired. It's going to be tricky for some of them to say, we're not going to have trucks for that. I can go work somewhere else without a requirement. But the public is much more tolerant of private sector decisions about this than they are about the government forcing them. And that's why the emotional battles about schools will be so visible, because that's a public sector decision-making, and universities are not seen the same way as independent if they decide to do that. So employers can do it, but their problem will be if they lose employees for that. And governments directly, if they're in an area that's very hostile to this, will find the reaction. And somebody asked me, what do I mean by reaction? I mean mass demonstrations. I mean walkouts. Which people don't want to see in institutions. But businesses would be much easier at moving in this direction.
Okay, we only have a couple of minutes left, and we've gotten a bunch of questions about mask mandates, which our poll did not address in last month. But obviously they're in the news again since the CDC gave yet another different advice yesterday. Bob, what do we know about mask mandates?
Other polling groups just did, and there's sort of two findings. In general, the public doesn't favor it, but it's close. But what's going to explain what you see in the newspaper over the next 2 weeks is 66% of Democrats favor mask mandates by government right now. 80% of Republicans oppose it. So I can tell you what your news headline is going to be, but they're split. But the one side, and that's important for people who feel public health they have to move in this direction, when told that the number of cases in their county was really getting higher, and people shifted. When you're at the county level and you tell me that the cases are just growing every night, you actually shifted, with more people saying, okay, I'll live with a mandate in the county because of the cases. But in the aggregate, they lean against it. And surprisingly, the unvaccinated leaned against it too for that. So most know, but that is there. But if I'm a mayor, I will find, if it's a Democratic city, substantial support for doing it. And if I'm a Republican area, there's going to be just a lot of pushback. My constituents don't want to go in this direction.
And that split is the same for schools, or is there?
No one has asked yet about schools. It shows how fast this is going. And people may have very different views about schools. So we have to wait. It's too soon. And on that, as we did with our own about vaccines, it's important to have the views of parents and people adults in households with kids, because they're the ones who are going to react, call, write letters, op-eds. Others not involved in the schools will not be as passionate one way or the other. But it's parents groups, which we don't know, are really going to be very important about how school districts find this works out.
Okay, I've just been told that we can go a couple of minutes longer, not forever, but we can take one or two more questions. Breaking down the messaging we're talking about, the community-based messaging, how do you really, we've been told for a long time that young people weren't at risk, or young people weren't so much at risk, or, that was what we heard back in 2020, because that's what the best available knowledge showed us. They're still obviously not as much at risk as older people, although there are a lot of unanswered questions about Delta. So how do you target messaging? Do we know anything about targeting messaging toward the younger population?
So we, again, it's the parents who make, unless we're talking about the 20s, if they're below 21, parents are much the critical area. The issue, and this comes out of looking at political messaging and everything. What's important for a younger adult to know is it could happen, you could die, you could be sick. And what we tend to do is report percentages. It's 3%, but actually people don't want to die. And if the message is from somebody, I am caring for people in my Alabama hospital who are young, who are at risk of dying, that's a very powerful message. But giving them statistics, well, it's 40% don't get very sick and 12 do, that just doesn't move people. But people are not willing to absolutely risk their lives if they think that's what they're doing, or their children's lives. They could die. It's not that common, but they could die and they could suffer debilitating illnesses. That is the message, and it has to be, again, by someone who is caring for people of those age groups, trying to keep them alive, and just says you can do that. What it can't be is just the antis, and America's just divided on this, about the medical science, public health establishment. They don't do it, and a local scientist isn't going to win either. It is more heavily clinicians caring for very sick young people who report they can die. And I don't want you lying here and taking a chance because it's only 0.8%. But that is, I believe, the most powerful messenger are clinicians caring for very sick people who are honestly telling you that if they had a vaccine, they wouldn't be lying with an incubator on them.
There's a question about emergency use authorization. Sometimes you hear people who say, well, I think a little background is that when there were sort of three groups early on in the vaccine, when the vaccines became available, there were the people who couldn't wait to get them. There were the people who said, there's no way I'm going to get this thing. And there was a big group in the middle who weren't sure. That big group in the middle has shrunk and shrunk and shrunk. More of them have gotten vaccines, but there's
Right.
still a hesitant slice. So the people who say, I won't take it because it's still an emergency use, I want the FDA to give it final approval. Do we have any way of knowing whether, for some people, yes, that'll be the case. When it gets final approval, they'll get the shot. But do we really, a lot of people say that, but once the FDA gives final approval, do we have any way of knowing whether that really will be enough, or some other reason not to get the shot will just supplant that one?
Well, so, the polls that ask people why they aren't taking it, it appears to be a factor, but it doesn't appear to be the dominant factor. They're worried about it. But what I'm worried about is my other point is the people not taking it are not as worried about the virus as everybody in medicine and medical science might be. And so that worries me that they're not worried, because there's a trade-off here. Yes, there might be some side effect for someone, but if I really believe I could die, or my youngster could die, and everything else, I'm going to look at that trade-off very differently than if I think this is just exaggerated. It's a weak case of the flu. And it looks like people not taking it are not taking the risk of what can happen to you very seriously. And that, you got to start that, and then you deal with the trade-off. So the FDA, I think when they finally get there, it'll help a little. But there'll be a great disappointment to believe that that's the principal issue, that people holding out if they only had an FDA approval. I don't think that's true.
So there'll be some people for whom that's what
Right.
they need. There'll be a lot of the people will just find another. It won't be enough, at least for them.
Yeah.
Okay. And then, do you think that we'll see, this question is sort of, there's a regional outbreak. Some parts of the country are hit harder than others at different times. Is that how the mandates would follow? Is it going to be mandates where they're hotspots, or is it going to be mandate where a governor thinks they can, they believe in the mandate? You've got some governors who have made very clear they're not going to mandate anything.
Yeah, so
the legislature who've outlawed it.
Yes, the Avi is, and I know all of us just want to believe that political figures just will do what the best science does. But in conservative states, they really don't like mandates. It's a very broad view. And they have said they're against all kinds of mandates, and particularly encouraged by the federal government. So we are going to find an oddity. The reason why I'm trying to see ways to convince people is that the states with the highest cases will find politically the most resistance to mandating. And the states with the least cases will proudly tell you that they have mandated everybody has to get a vaccine. And at the end of the day, that's not going to solve. That's why I so focused on the physician from Alabama. It's a high case state. And she might have a greater impact, but I don't expect the governor of Alabama to be for mandating. I just think we have...
She's very pro-vaccine, but she may not do...
Yeah.
She's the one who came out and yelled at everybody unvaccinated last week.
Yes.
But which might not have been the best public health message either.
Yeah.
But there's a difference between being strongly... She is very clearly pro-vaccine.
Yes.
But that doesn't mean she's going to go for a mandate, either because she thinks it's politically untenable, or she just thinks it's not going to work in her state. You know, you can get more resistance.
Takeaway here, I am convinced that if healthcare institutions move in this direction across the country, and they make an effort to reach out to also educate the public in their community, well, we're just not forcing our workers because it's infection. We're really worried about what happens to them and our patients, that they can have an effect in some of these communities of moving some of people not being as hostile as it is, and they may move the discussion about mandates further. Once you've decided the biggest hospital, one of the biggest employers, it's legitimate for them to do that, people may change their mind and move over. But the healthcare institution, our finding, the 60 institutions, I think that is the pivotal next step to build on.
Okay. I think that covers most of the questions that have, and most of the time we have. So I think that's going to conclude our discussion. The Q&A was jointly presented by the Forum at Harvard T.H. Chan School of Public Health and Politico. Thank you, Bob. Thank you to the viewers for joining us and for submitting your questions. Be well, stay safe. We'll see you next time.